looks like it is. Hey, now we're in business. All right. Great to have everyone here. If you're part of our community, welcome. It's always great to have you here. I know I always have people here for the last almost year with us every Wednesday. And if you're new, I want to welcome you as well. Thank you so much for being here. This is a community of people and a resource and a place where you can come to feel comfortable and confident about taking care of your spine non-surgically, even if you're dealing with big issues like disc bulges, disc herniations, facet arthropathy, spinal stenosis, most of the things that cause back pain for people. And we teach you how to manage that from the comfort of your home with quite a large success rate. So let's talk about that for a minute. So we're going to be talking about today how to heal your back pain naturally from your home with a 90% success rate on average. And I'm not fubbing on that. That is real numbers from 24 years of practice and also from a lot of research articles that I've shared over the last Wednesdays. So if you haven't seen any of our old lives, you can go back and look at those, and I will show you that, but I'll show you one today as well. So, if you have back pain, and I was there with you at one point, these might be some of the questions that you ask yourself. Why does my back keep hurting me? Am I gonna need to get surgery at some point? Am I ever gonna feel good again? I hurt my back really bad, and some of these were the real questions I was asking myself. Will I always have this pain in my back? What if my back pain gets worse as my life goes on? What if I become paralyzed someday? Like, is that a real thing? Is that a real possibility? Not a good feeling or thought to have, right? And am I ever going to feel like my old self again? These are common questions we ask ourselves when we injure our spines really bad, and it's really affecting our life, or we don't have a normal quality of life anymore. And some things that you might be afraid of, and I know that I was, is that, am I always going to have this back pain? Is it ever going to go away? I've tried everything, right? This is common. I hear this a lot in my practice. Doc, I tried everything and nothing has worked for me. That you might never work again and provide for your family again, which is a big deal for a lot of people, being able to be a provider for their family and their children. Are you ever going to feel and be able to be active again in your life? That's not a good feeling. That you will maybe never be the spouse or the significant other that you want to be again, because you have a person in your life that you love, and you want to be the best for them, right? And be the best for yourself. That you won't be able to play with your children or your grandchildren. That's, like you want to. Go wrestle in the yard, right? And versus sitting in a chair and just watching them play. Or that you might be in a wheelchair someday. So, those aren't comfortable questions, right, to ask ourselves. And I had to ask myself some of those questions as well, as you're going to see. So I'd like to share, if it's your first time, I'd like to share just a little bit about myself, just for a few seconds, and show you why I had these same questions as well. So, if you don't know me, I've been in practice for over 24 years, full time, specializing in bulging and herniated discs and spinal stenosis and facet arthropathy. I was fortunate enough, hopefully, because we did really great work and helped a lot of people get back to the quality of their life, that we were on the cover of the largest chiropractic magazines in the world. And in 2019, 2021, we're voted one of the best spinal decompression doctors in the entire United States. I had the opportunity over 24 years to work with some amazing people like Jeff Foxworthy and Suzanne Summers, Ed McMahon, Dr. Wayne Dyer. You can see some other pictures there. There's just a few. But this is why I think that, I can talk to you, is because this was my back a few years ago when, I had a bad crash at the skateboard park trying to inspire my boys to go for something in their life, and not being afraid to fail. And, sometimes when we fail, there's prices to pay, right? This was the price I had to pay. The only time I've ever seen a back like mine was like that is when there was massive fractures taking place in the spine. It was a scary time for me because I couldn't work anymore. And here the guy that's fixing everybody's back now needs to get his fixed. And not a good feeling, quite scary to be quite honest with you. I was in a tremendous amount of pain. And I had to go, wow, can I really fix things like that? So I decided that, I'm gonna heal my spine on its own. And that's what I'm going to share with you today. And how did I go about doing that? And how did I do that for thousands of other people? So, one of the things that I think is important is to understand is what causes back pain for people. And there's two major causes of back pain for people. Number one is the spinal discs, which I'll show you a picture in a second. And the other one is the facet joint. So those are going to be your two major causes of back pain. Hey, Stephanie, great to have you here as always. My BFF from Pennsylvania. I appreciate you, Stephanie. So let's talk about this. And Stephanie, I mixed it up for you a little bit today too, just so you know. So let's take a look at the disc here. So the spinal discs are made up of two parts. I know you probably know this by now, Stephanie. You have this inner part right here, which is called the nucleus. That's this section right here. And it is literally like a jelly. So the next time you go to Dunkin' Donuts or something like that, and you get a jelly donut, if you like those, that jelly inside is exactly what it's like inside our disc. And that jelly is supposed to stay contained inside this disc by these outer rings. They're almost like belts. So imagine if you had 12 belts to hold your pants up. That's pretty much what's happening here. And when they're healthy, they look like this. When they become diseased and torn, they look more like this, where they tear. And that can cause a lot of pain to the spine, and it can also allow this jelly to start to ooze out. So if it starts to ooze out but it stays within the disc, it's called a disc bulge. If it comes outside the disc, like you see right here, without getting too technical, we call that a herniation. So that's going to be one of your major causes of back pain when there's pressure onto the nerve branches. But another thing that can do it is we're looking down into like your body right now is, again, here's the jelly we were talking about. Here's the rings that go around the outside. They're not supposed to be torn like they are right in here. And so that then that jelly can then get pushed out because of the weight of your body coming down into your body. And it can cause pain two major ways. It can have a physical pressure because there's a substance that's pushing on the nerves, like you see right here. And where you see all these little yellow and red little bulbs like this, those are pain sensors. They're called nociceptors. They run off of a thing called the sinovertebral nerve, without getting too nerdy about it. And these go all the way around here. So they don't just stop where you're seeing them on my picture right there. And they can cause back pain because when you tear the disc, you get releases of chemicals, irritants called cytokines, and those cytokines irritate those nerve endings. And this typically a lot of times is what you're going to see in a disc bulge when there's a lot of pain, is the chemical irritation to those nerves. So that's how you're going to get pain if you're dealing with a bulging or herniated disc. Now the other way that we're going to typically get back pain is in the back part of the spine called the facet joint, and the facet joint is this joint that runs right through here. And this one has arthritis to it. That's why it's all kind of looking lumpy right here. So if you go to a pain management specialist or an orthopedic surgeon, what they're going to want to do is they're going to do exactly what you're seeing right here. They're going to stick a needle in there and they're going to inject a lidocaine or some sort of numbing agent, possibly a steroid in there as well, to try to calm down the nerves. The issue is that if you want to keep a surgical approach to your spine, this is it's a way to go. If you're looking for a non-surgical approach to actually get this area to be healthy again, you have to take a different approach than just injecting it constantly with medications to numb it. It's like having a headache, for instance, or you just, you keep numbing something, your thumb, but you keep hitting it with the hammer again, over and over again. You're not getting anywhere. So we want to help you have progression of your spinal health. And so I'm going to teach you and show you a process today that manages both of these, not only for disc bulges or herniations, but also if you're having pain because of your facet, it manages both of them, which is really cool, if you ask me. So how do you do that? Well, the number one tool in the world to do this is spinal decompression. And we're going to show you how you can do it actually from your home. So what's the benefit of a table like this right here is that it takes diseased tissues in your back that are getting compressed, and it starts to decompress them. It creates more space, like it's taking a load off of your back, literally. And that's what it does. And the beautiful process of doing that is that it brings nutrition into the disc, because the discs are living tissues. They need nutrition to live, and that's one of the part of the things that we teach you as well. But also hydration. It needs to make sure it's getting proper water supply to it, and it's got to be able to get rid of its waste products as well. So a lot has to take place in that disc And this table recreates what's supposed to be happening in your body naturally, okay? So it's super cool and has very high success rates. And most neurosurgeons who have started using this in their offices started doing a tremendous less amount of back surgeries because they were having such high successes with it, which is really cool. So what's it do? Well, it does this. It's pretty simple. You have material that's pushing out, which I'll show you on an MRI here, or some pre and post MRIs. It helps very gently suck that material back in, and it's super gentle. You don't even feel like it's taking place. And over a period of weeks, you can start to get their discs to heal. So you're going from step 1, 2, 3 to 4. And that's how this works. So here's a research article to show you that, so you don't have to take my word for it. This is 219 patients that were reviewed in Orthopedic Technology Review in 2003. These are all pre-surgical candidates. These are all people that were about to go get surgery for their conditions of bulging or herniated disc, and they decided to do spinal decompression, and this is what they found. 86% of them were able to move properly. 86% of them as well had almost immediate resolution of symptoms after their first 2 treatments. 92% of them had physical exam findings improvements. That means their legs felt strong, their arms and hands felt strong again. They were able to move them properly. And 84% of them remained pain-free for up to 90 days afterwards. And if you look at some of the long-term studies, up to 4 years for people, and that's what I've seen in my practice as well. So it has a tremendous long-term benefit. So you're not just masking and numbing, like patching a pothole, you're actually repaving the road, or you're actually getting your spine to repair itself, which is really incredible. So I'd like to show you this. This is Candace Maxwell. This is one of my patients. And she would like to share her testimonial with you. And so I'll see if I can get this to sync up really well.
Hi, my name is Candace Maxwell. I am an actress, a dancer, and a lover of life. I met Dr. Sean McWilliams when I was referred to him by a great family friend of mine for an issue I was having. I was set to film a television show, living out like my wildest dreams, something that I always wanted to do, but I was suffering from like dilapidating pain, so I couldn't sleep through the night. I had like an extreme pain down my neck, shooting through my arm, tingles down my arm. Couldn't turn my neck, couldn't move, just in dilapidating pain that did not stop. It was like ongoing and throbbing, and just it really affected me physically, mentally, and emotionally. So I was honestly at my lowest, and I did not know what to do. But a friend of mine, again, referred me to Sean. I got to meet him. We checked out my neck, and I found out that I had degenerative disc disease with a bulging disc in my neck, and I didn't know how I got it. I didn't know where it came from, and it just completely kind of changed and shattered my life in that moment, because I thought I was going to be stuck living in pain forever, and I wouldn't be able to dance or work out or do the things that I genuinely love from the bottom of my heart ever again, much less like live my life with pain-free again. Like I thought it was a wrap for me. But Dr. Sean told me about non-surgical decompression. So I learned about decompression. I learned about what was going on in my neck, and how my bulging disc was affecting my spine, and how through these treatments, this package of treatments, this ongoing set of treatments, we would be able to release that pain, release that pressure, build back I guess I would call it space. I'm not using the right words, but the space in my neck, and relieve of that pain. And through the process, it was a long, grueling process. Like I had to be dedicated to my sleep routine and drinking water, things like not smoking, things like sleeping on a certain pillow. I really had to be diligent, but he guided me through every step of the way, provided vitamins, healthcare, just everything, a spiritual, mental, emotional way of healing. And not only that, but I didn't have to have surgery, and that was a big concern of mine, was being cut open into and living with the repercussions of surgery, because nobody tells you how daunting healing can be and how sometimes these surgeries are not effective. And I am 100% healed. I dance again, I move again, I act again, I live pain-free, and I'm so thankful for Dr. Sean and for his wisdom and his knowledge and his ability to share with people and want to make his patients' lives better. And I'm lucky to have been local and been able to just drive to Dr. Sean, but so many people don't have that access that I don't take for granted, but a lot of people are in countries where they can't just drive around the corner and see Dr. Sean. They may not have the financial resources to be able to cover the cost of the treatment. But with what Dr. Sean is doing with bringing his course to you via the World Wide Web, you can contact him from anywhere in the world. You literally have Dr. Sean virtually in your home, treating you with the same care, the same emotional, spiritual, and mental care and physical care to feel free again and to be able to live your best life. And that is what he offered to me as a doctor and as his patient. He's just wonderful, and I would say a lifelong friend. So if you're dealing with any pain in your spine, your neck, your back, this is the course for you. I stand by that 100%, and I can say with all my heart that I'm happy and I'm healed, and I'm so thankful, and I hope that the gift reaches you as well. Yeah, happy and healthy.
Well, thanks, Candace. And if you don't know who Candace Maxwell is, get on YouTube, go take a look. She's been in a lot of amazing movies. She's an incredible actress as well. And she couldn't act anymore. She literally had to stop her entire acting career for 3 months while we healed her spine. But now she's back at it again, full throttle. So cool to be part of that. So I'd like to show you just a couple pre and post testimonials here, so you can see some changes in people. So when you go to you can talk about symptoms all day long, but when it comes to talking to surgeons and talking to pain specialists and orthopedic surgeons and things like that, and neurosurgeons, they want to see the evidence. And the beautiful part is that I have thousands of people that I can show you in pre and post. So I'd like to show you some pre and post MRIs, because at the end of the day, I want to make sure that your disc is healing for you. So let's take a look here really quick. So this is a gentleman that came in, had severe low back pain, severe sciatic pain going all the way down to his buttock and leg, could barely sit, could not perform his job at all. And when you look, if you're having back issues, you know what I'm talking about right here, people. This big, massive herniation. And in 12 weeks, following our program that we created, that was him. That was 12 weeks later. Almost zero back pain, could sit properly, could work full time again, could be the husband that he wanted to be. That's the changes that you can do from being able to do the course that we created, and you can do this from your home. So let me show you one other one. I have lots of them, but I think 2 gets the job done with Candace. So here's another person. Massive herniation right here again, severe low back pain, sciatic pain again, constipation, and could not be the dad that he wanted to be at all. And you look over 12 weeks, this is non-surgical, everybody, non-surgical. This is doing spinal decompression. That's his disc, same level disc, 12 weeks later, after doing spinal decompression, no back pain, no sciatica, was able to be an active dad again and get back to his life. So if you were to pay and have surgery to do this stuff, you're looking at some big numbers here, and your spine's never going to be the same again after it gets invaded like that. So if you go in and do a spinal fusion, which I'm seeing more and more of, you're looking at about $138,000 on average. If you go in and have a laminectomy where they cut out the back part of the bone, you're at $52,000 to have this done. I got to say, that stuff started making me sick. And not that people didn't have to pay, when they came to see me, thousands of dollars, but I wanted to create a course to help people be able to manage this from home. Even if you didn't have a doctor that was certified or had the tools to do it where you live in the United States. And you go out and you live out west, and if you're with me from out west, you know what I'm talking about. Sometimes it's hours and hours to get to a doctor. And I wanted to help people like you. And so I created a course that did a couple things. One was I wanted to have a course that you could do from your home with my guidance that would have a very high success rate. And so when you look at this, I wanted a course that would give you an 88 to 91% success rate that you could do from your home. I wanted it to be affordable to almost anyone. I wanted to make sure that you could heal your spine from your home if you lived anywhere in the United States. Does not matter where you live. I wanted you to have expert guidance, so you have my 24 years of experience creating the course and showing you how to do it. And we do weekly live access like we're doing today, so you can come and ask questions and share your testimonials with everybody. And if you need more than that, then we do offer one-on-one coaching where if you need your hand held a little bit more or you want to speed the process up, we have some higher level courses like that as well that you can do. But everything above that you get all for the same cost. So the course that we created is called DISC University. I'm super proud of it. You can get all of that. We send you the piece of equipment. I'm going to show you a couple of things that are in DISC University to help you heal really quickly. But you get it all for $997. I wanted to make it affordable for anyone, so money was not a problem to do it. And how can I do this? Well, I don't have the overhead of a huge office anymore. And I don't have to pass all those costs on to you. So what do you get? Well, I'll just go over a couple things. One of the most important things is I teach you all your do's and don'ts to make sure that you know what to do and what to avoid. So your guidelines for maximum healing is super important. Most doctors aren't going to tell you this, and they're going to let you just kind of roll the dice on if you're going to be successful. I tell you every single thing to do and don't do so that you speed up your healing and feel the best, the fastest. One of the most important parts is I teach you how to do your spinal decompression from your home, and we send you the piece of equipment to do that, and you get to keep it. How to track your progress, when to use ice versus heat so that we can reduce inflammation and pain quickly for you, how to make sure that your discs get all the water that they need so that they can heal properly, and which basically the benefit is that you feel better the fastest. We teach you about a bunch of other stuff as well that you're welcome to watch so that you understand how your discs and your spine work so you can keep it healthy, from stretching to core exercises. One of the big ones is a lot of people get an MRI done and they don't know how to read it because they kind of look really strange. I teach you how to read your MRI, and I teach you what all the big words mean. And when you're ready, we teach all your core exercises as well, so you get a lot. But the benefit of doing all that is I want to speed the healing process up for you so that you feel good as quickly as possible. That's what all those are for. So there's 28 video modules in there. You can watch them as many times as you want. We send you the piece of equipment as well. We do it all for $997, but the cool thing is because you're on with me today, if you look right here in that coupon code box, because you joined me today, for the first 10 people, if you type that code in right there, Relief 20, that gives you 20% off. I very rarely give discounts on my course because I think it's affordable as it is, and there's a lot of costs in there involved for me, especially the piece of equipment. It's very expensive that we send you, but I want you to start to feel better as quickly as possible. So there's links if you look in the bio. If you go to my Facebook, on my bio on there are links to DISC University. Please go take a look at it. If you're suffering with back pain, there's a good chance you don't have to anymore. So please go take a look at DISC University. It's super easy to purchase if you feel like it's the right fit for you. Also on YouTube, there are links on my channel as well to get to this course. And I know that if you try it, it'll make a difference. I always tell people you can always get surgery done, but once you get surgery, you can never undo that surgery. The beautiful part is that if you put, you can do spinal decompression and learn all those things and do it from the comfort of your home. You don't have to drive anywhere. There's no co-payments anymore. You don't have to organize people to watch your children for you, and all the stuff that takes place to go to a doctor's appointment, all that stuff, you don't have to worry about it anymore because you get to do it from your home. So I hope that you feel like it's been a good investment of your time joining us today. I want to thank everybody for being with us. If you have questions, please direct message me or leave me a comment. I would love to answer those for you as well. Stephanie, thanks so much. I hope you have an amazing day as well. You're awesome. If no one told you that today, I'm telling you that. And thanks for joining me. We're here every Wednesday to answer your questions, give you support, hold your hand if you need it while you're going through this process so you don't feel like you're alone, and speed the process up so you can get back to your life of feeling great again. All right, see you next Wednesday, and love and appreciate you.